there. I'm Jamelyn. I'm your nurse. Could you please verify your name and your date of birth for me?
I'm Emily Cogman. My birthday is 12/17/2001.
Perfect. That checks out. And who do you have here with you today, Emily?
My mom.
Hi, I'm Izzy.
Hi, nice to meet
Nice
you,
to
Izzy.
meet you.
Jamelyn.
Nice to meet you.
Okay, so I understand, Emily, that you are a type 1 diabetic and you have recently been experiencing some hypoglycemic episodes. So that's why you're in here for today.
Yeah, I've just been really I've had a bad headache. I get some shakiness and just really tired all the time.
She seems more anxious than usual.
I've been really nervous about just lots of things in my life. So.
Okay, how often are these episodes kind of occurring for you?
2 to 3 times a week.
Yeah.
Sometimes every day.
And it's pretty much always the same symptoms that
Yeah.
you just described?
I noticed it's on the days that she's been skipping breakfast.
On the days that, yeah.
I just don't like eating breakfast.
Yeah, that's something that we are definitely going to talk about later, but first I'm just going to ask you a little bit more of your symptoms. So first off, how's the lighting in here for you? Is that okay? The lighting, and what about the noise level? Is everything okay for you?
It's comfortable.
Okay, and then these headaches, are they just kind of all over pain?
Yeah, it's more just really tightness in my head and just making me feel nauseous.
Okay, totally. Tightening in your head that makes you feel nauseous. So I'm going to talk to you a little bit about what a hypoglycemic episode even is. So I'm sure being a diabetic, you have heard about the importance of, maintaining an adequate blood glucose level, but we're also going to kind of go over that a little bit today, and then I'm going to end up giving you this flyer, which this is all stuff that we're going to talk about, and then I'm going to send you home with this.
Okay.
So the first thing that we're going to talk about is you might not even really know what is hypoglycemia. So glucose is our body's main energy source, and we usually get our glucose from food. So our dietary intake of glucose is super important, especially for someone like you who's a type 1 diabetic, in maintaining that good dietary glucose so that we can keep that blood glucose level up. So basically, when our body's starting to work hard and function properly, we use that glucose as our energy source so that we can work hard and function properly. So now you might need to know what causes a hypoglycemic episode. So since you are a type 1 diabetic, you use your insulin, right? Mm-hmm. And if you are using too much of that insulin, then that is going to use up that blood glucose. So we want to make sure that you are adequately checking your blood glucose regularly so that we can adjust your insulin levels if needed.
How often should we be checking her blood glucose?
So in the case of a hypoglycemic episode, if you're experiencing those symptoms that you just described to me, we like to do this 15 to 15 rule. So if you're having this episode, you are going to eat 15 grams of carbs, wait 15 minutes, and then check your blood glucose level.
What are some
carbs? What are some good ones I should eat?
So some good carbs are maybe fruits or anything with pasta. There's lots of different sources of carbohydrates that you can incorporate into your diet. What are some carbs that you're currently eating right now?
I just like bread, I guess.
Yeah, bread's a good one.
Sugar, so.
Yeah, sugar is a quick source of glucose, but we like to maybe do more of the breads and the pastas because that's gonna give you a long-term glucose.
I see you have juice. Maybe we could start buying some juice.
Yeah.
Yes,
Okay.
buying apple juice, especially if she is experiencing that hypoglycemic episode. Pulling out that apple juice is going to be very helpful for that. So that's definitely a good idea, Mom. As you can see, some of these symptoms are kind of like what you were talking.
How can I prevent these from happening all the time?
Yeah, so prevention of the hypoglycemic episodes includes mainly just regularly checking that blood glucose level.
Okay.
And so a good rule of thumb is to check it in the mornings and at night and before meals. So that's just pretty standard rule of thumb of when you should check it. Obviously, if you're experiencing the symptoms, check it then as well. Anytime you are checking your blood glucose levels, this might be a indication of whether or not we need to adjust your insulin dosage, because like I said earlier, taking too much insulin is going to be a cause for that. Yeah, it's a problem for that hypoglycemia. Another important thing is skipping meals. So this is super important because we want to maintain those adequate levels, how I've been talking about. So it's really important that we don't skip meals because we don't want to cause a tank in the glucose. So I'm also going to talk to you about like why everything that I've been saying is super important. A complication of this is kind of neurological problems. So without blood glucose, our brains are not going to be able to function as well. So we need to maintain that adequate levels in order to prevent something like a seizure or an episode of confusion from occurring. So that's why it's super important that we don't put ourselves at risk for these further complications.
Yeah, it sounds important.
Okay, I'm just a little bit concerned because she is so active,
I play a lot of sports.
and so I'm wondering if that's going to affect her insulin and glucose levels.
Definitely, increased physical activity requires an increase of glucose usage. So
I'll
your
just
levels.
have to set some like timers to make sure I
Okay.
remind myself.
Yeah, on your phone.
to
I can
check
set some as
those.
well.
Yeah.
Yes, I think that would be a really good idea if you guys set timers. There's a way that you can do it on your phone, that these timers can go off consistently every day at the same amount of time. And it's really important that you aren't lenient about like, okay, my timer went off, I have to check my blood glucose now. And maybe you could use mom to hold you accountable. She says she might set a timer on her phone as well. Do you guys have any other questions?
I'll do my 15 to 15 rule. So I'll eat my 15 grams of carbs and then check it in 15 minutes again, which I know how to check. I've been doing it for a while, so I feel pretty confident.
Do you want to like talk it to me? Like, how do you usually check your blood glucose?
I wipe my finger off and prick it with a thing. Wipe the first blood drip off and then check it with the thingy.
Okay, that was an awesome demonstration. Could you also just like repeat back to me, like maybe like why it's like super important for you to check your blood glucose levels?
Because if like I'm dropping all the time, it can cause seizures and confusion, and also it's just brain activity and
Yeah.
It's your main energy source.
I don't want to be tired all the time like I am.
No.
Gotta be able to play my sports.
Yeah. Well, just watch out for those symptoms
Yeah.
and try to
Set
prevent
those
it.
reminders, and I won't skip breakfast. I'm really bad about that. I gotta eat my breakfast.
Yes.
Maybe I'll start making you breakfast.
Oh,
So I'm gonna send this home with you guys. And it was really great to meet you guys, and I'm super happy that we were able to talk about all this today.
Yes.
thank you.
Thank you so much. We'll call if we need anything.
Of course.
To address the health literacy of our population, which was in this case a female adolescent, we used simple terms and tried to avoid medical jargon as much as possible. We tried using big concepts but making them simpler by kind of chunking them into understandable sections. We also used a visual aid to help the patient understand visually what was going on with her hypoglycemia, and it also just provided the patient and also the nurse a way to review the information together. And then lastly, we used effective teaching methods by using the teach-back method, just to ensure that the patient could fully understand her condition and could reword it into her own words back to the nurse. And then we also used demonstration methods to ensure that the patient knew how to check her glucose level in the event that she had a hypoglycemic episode. If we were taking care of a different population, such as a younger child or an older adult, we might use simpler terms and try to avoid those medical terms as much as possible. If we were taking care of a person of a different culture, we might use a handout that's in their own language. And if there was a language barrier, we could have asked for a translator to assist us in communicating.